Topic Our topic is drug and alcohol misuse disorders during pregnancy. So actually, what is substance use disorder? So substance abuse is defined as a problematic pattern of substance use. It affects your health and well-being, and it can range from mild to severe, and it is actually a treatable mental health condition. Some common substances that people use are going to be alcohol, opioids, cocaine, methamphetamines, marijuana, and things of that nature. So why does this even matter? Why is it important? So substance abuse in pregnancy, it affects the health of the mother and the growing fetus. Drugs and alcohol can cross the placenta, meaning the fetus is exposed to the substances that the mother is using. This form of exposure can interfere with normal growth and development before birth. So a very common opioid or substance that is often used is called methamphetamine. It's commonly known as meth. It's a highly addictive stimulant and it affects the central nervous system. It increases dopamine levels and causes intense energy, alertness, and euphoria. Meth use during pregnancy is very dangerous and is linked to poor prenatal care, malnutrition, and increases maternal health complications. Using methamphetamines during pregnancy, it can reduce blood flow and oxygen to the fetus, can cause the mother to have high blood pressure and an increase in an infection risk. Also, you may experience placental abruption, which can be fatal to both mom and baby, and additional cardiac anomalies. And mental health concerns can also complicate pregnancy, such as anxiety, depression, paranoia, and psychosis. So, if you have a mother who is using substances for whatever reason, this is going to be a collaboration, teamwork type care to make sure that the mother is getting care not only from her OBGYN, but also seeking those mental health um, services that she may need as well. Um, if you are using methamphetamine during pregnancy, these are what things that can happen. It can negatively affect development. Any substance use during pregnancy can cause an increased risk for fetal distress, low birth weight, preterm labor and miscarriages, and also can have IUGR, which is intrauterine growth restrictions. If once that baby is delivered, the baby can also have some withdrawal effects, and those things can be difficulty feeding, irritability, tremor, sleep disturbances, respiratory issues, and they may also have some long-term effects as far as developmental and behavioral delays, problems with attention and concentration, and emotional regulation. As I was stating earlier, uh, while a mother is using substances, it's going to be a collaboration, it's going to be teamwork, it's going to be different. Everyone's going to have to do their part, long story short. You're going to want to build trust and rapport with that client because a lot of patients are going to be ashamed that they have a substance abuse problem and now they're pregnant. And you don't want to just abruptly stop them from using whatever substances they're using because their body can go into a withdrawal state. And then that withdrawal state can still also affect the fetus. So this is going to be a interdisciplinary approach, trying to collaborate with one another and be in teamwork. As far as nurses, we're going to assess the fetal heart rate and the fetal growth often. We're going to assess for blood pressure and pretty much all vital signs and signs and symptoms of placental abruption. We want to make sure that we're being non-judgmental to the patient, educate them on substance use, give them some support, mental health care, promote consistent prenatal visits, and it will allow for hopefully a well-off or safer delivery.
All right, so opioids in pregnancy, that includes drugs like fentanyl, oxycodone, and hydrocodone. Warning signs of an expectant mother taking opioids in pregnancy include inconsistent or sporadic prenatal care, late prenatal care, or just not even getting prenatal care and showing up to the hospital ready to deliver, poor nutrition, previous encounters with law enforcement, and then marital or family disputes. Maternal behaviors that can affect the fetus itself include decreased access to healthcare, decreased compliance with healthcare, increased exposure to violence or violent situations, and then it also poses a risk for increased risk for mental health and infection to the fetus. So there are many risks to the fetus with mothers taking opioids during the pregnancy. They include things such as miscarriage, placental abruption, preterm labor, fetal abnormalities, which include ventral septal defects, atrial septal defects, hypoplastic left heart syndrome, neural tube defects such as spina bifida, and then gastrointestinal issues such as gastroschisis, and then clubfoot. Going on to then CNS effects. CNS effects include hyperexcitability, jitteriness, tremors, and definite sleep problems, whether they cannot complete a whole sleep cycle, or they can't fall asleep, or they can't stay asleep. It also includes intrauterine growth restrictions, so those babies generally end up small. And then the baby itself might go through narcotic withdrawal once delivered, and it could ultimately result in fetal death. So treating the mother during the pregnancy can be challenging for the nurse taking care of the mother, but it is important for you to realize that the mother is going through challenges themselves, understanding that there is a social stigma against them, and they get tons of negative feedback as it is. They're already dealing with a lot of internal shame and discomfort, and then all the external judgment as well makes it very difficult for them to seek care and try to make steps to go forward to get better. There's also the fear of loss of custody once they do have the child. And then there could be simply the lack of education, that they just are not aware of the effects that the drug use is having on them and their fetus. They also face barriers to treatment. Treatment programs don't address the pregnant women's issues. The treatment programs focus mostly on the treatment itself, but not really looking in depth to how it's affecting the pregnancy and the fetus itself. There's also a very long wait list for treatment centers. And then, of course, there comes the issue of finances, which is the lack of health insurance or taking specific health insurances. Those also add to the treatment challenges of the mother. So while taking care of the mother, it should first be said that screenings should occur for all pregnant women at their very first prenatal visit, whether they have a history or not of drug use. It's important to perform the screening when the woman is alone and use a non-judgmental, empathetic tone, just so that they feel comfortable with this conversation and are more likely to be honest. When doing the screenings, it should include the past drug use and present drug use as well. If the drug use is current, you need to determine whether the drug is, determine which drug is being utilized, the frequency, and the amount, just so that there is a baseline of how much is actually being used. Always use valid screening questionnaires. Provide confidentiality as best as possible. During screening, always look for coexisting mental health disorders and intimate partner violence, as there is a correlation to increased risk for both of those with drug use. So if a baby is born with the mother using opioids during the pregnancy, that child is at risk for NOWS, which is the neonate opioid withdrawal syndrome. The treatment for NOWS is a dark, quiet room, a tight swaddle, gentle rocking, frequent small amount high-calorie formula, and breastfeeding. This is mostly due to that risk of IUGR and poor nutrition. And so you really want to help beef up that baby and give them the food that they need to be able to grow efficiently as they are going through withdrawal, and their metabolism is already kicked up from the withdrawal state. Medications you can give for a baby with NOWS is morphine. You can start to give the medication and wean them off, because morphine is an opioid, and so it's just doing a more gentle withdrawal issue than just a cold turkey and sending this baby into shock and possibly leading to fetal death.
Finally, we'll be discussing alcohol use in pregnancy. Contrary to popular belief, there is no safe amount of alcohol consumption during pregnancy. Unfortunately, though, many women do not know that they're pregnant for several weeks and may continue alcohol consumption habits into the first trimester and sometimes the second, and of course longer if they do have a history of alcohol abuse or alcoholism. Alcohol use during pregnancy can result in miscarriage, preterm births, birth defects, and sudden infant death syndrome. Alcohol used in utero causes many risks to the fetus, the most severe of which is fetal alcohol syndrome. While FAS is a spectrum, The most severe impact of this can be multiple defects, including abnormal facial features, neurodeficits, physical complications, and organ misformations. It's estimated that 5% of children will be impacted by FAS, and the fetus can also experience alcohol withdrawal, which can be life-threatening. There are many barriers to treatment for pregnant women who are suffering from alcohol addiction. Many of the barriers are similar to that of opioids or methamphetamines and really any other substance abuse disorder. Women fear the impact of stigmas, stereotypes, and often do not disclose their truthful usage to their providers and clinicians. There is a law enforcement component to this as well, depending on the state of residence. And oftentimes, mental health disorders, socioeconomic status, and education play a role as well. In addition to this, where you happen to live and the availability of treatment options will also impact the prenatal care you receive. Care management for the pregnant mother dealing with alcohol abuse really varies from patient to patient. There's quite a few hotlines, including samsa.gov, where moms can call and ask for guidance and assistance dealing with addiction. It's also recommended that mental health counseling is used in tandem with prenatal care, and oftentimes medications to assist in alcohol cessation can be helpful, though they can pose a risk to the fetus, so it's a balancing act between risk and reward in that situation. Overall, we should work to remove barriers to treatment and dissuade others from enforcing the stereotypes and stigmas that we put on to pregnant women who may be suffering from addictions. After all, we do want to take care of all women, regardless of their medical history or their bank accounts.